Hi, I'm Dr. Kenny Levine with Health Talk. We're seen on WEYW19.com and on Uverse 19. Our show is one that deals with issues and problems and solutions from the top of your head to the bottom of your feet. I happen to be a periodontist. I'm a dentist, but the show is not about dentistry. As a periodontist, I treat patients of all ages from 3 days old up to about 100 years young. Traditionally, our practice was dealing with gum and bone disease, but today we're very involved with cosmetic surgery, dental implant therapy, treatment of infants who have trouble nursing, and their great-grandparents who have trouble with their dentures. Tonight we're here with Iris Cohen. Iris, welcome.
Hi, Dr. Levine. Thank you.
Now, when I grew up, there were no big pharmacy chains. You went to the neighborhood drugstore and the pharmacist was a friend. As a child, we went to Mendelssohn's Drug. He was a friend of my father who was a dentist, and that's how I grew up knowing about the pharmacist. Today we have chains, and the pharmacists, many pharmacists I know who had their own pharmacies now work for Eckerd's or Walgreens or something like that. No more Eckerd's, I guess CVS, there's no more Eckerd's drugs.
Right.
But you have a little different niche. You want to tell us about it?
Yes. Well, I work at Broward Health Medical Center, so I work in the hospital.
This is like Broward General Hospital?
Yes.
Okay.
So what I mostly see, which is different than the retail drugs, is I see the IV drugs, the intravenous drugs.
Right.
So my patients are sicker. So if you're walking into the CVS, you're doing pretty well. My patients are in the bed. So they're sicker, and they have to get their medications through the IV route. So we prepare the medications that way. So the patients in the bed, a lot of times they can't eat, or they're post-op, or they're intubated, so they need their medications IV. So we do that.
So you formulate a lot of IV medications, but there's still people come around with little cups and you say, take these and take these.
Right. The nurses, right, we dispense the medications and the nurses administer the medications.
Now, different than your colleagues who work at Walgreens, for instance, you, ladies and gentlemen, work 24 hours a day, don't you?
Yes, the hospital's open 24 hours a day.
Do you work in only one of the Broward Health hospitals, or do you work in all 5?
I work in just Broward Health Medical Center, which is Broward General.
Do you ever have difficulty reading the prescriptions from the doctors?
Yeah, their handwriting is sometimes difficult to read.
You know, when I left dental school, I almost didn't make it out because I was writing too neatly. And they said, you can't leave dental school writing too neatly, so you have to take, they had a special course in learning how to write sloppy so that we would confuse the pharmacist. But actually today we have pre-printed forms that makes it easier. The only thing that I have to write is my signature, which is good. But in the hospital, you're going to go to something else, aren't you?
Right. We're going to go to, it's called CPOE, which is computerized provider order entry. So we're getting away from paper. So everything's going to be electronic. The doctors are going to be typing in the orders into the computer.
Right.
So they're going to type in the medication orders, the lab orders, the diet orders, the nursing orders, that, out of bed to chair. So we're going to try to be all paperless.
Is there a fail-safe system, say, that in the chart somewhere it says the patient's allergic to penicillin, doctor misses it and writes a prescription for penicillin? Will that come up on your computer?
Yes. Yep.
So
we get big red warnings. So if the doctor does miss it, now when he goes to type in a penicillin, he'll get a big red warning. And he'll have to, do some keystrokes and answer pop-ups.
Right.
And then you're going to have to put in details. Now, if a nurse is going to take an admission and you say you're allergic to penicillin, okay, they may not ask you, well, what's the reaction? When did you have this reaction?
Right.
Was it mild, moderate, or severe? Maybe you have no idea. Maybe your mom just told you, oh, tell everybody you're allergic to penicillin.
It's interesting. I grew up being told I was allergic to penicillin, and when I went to dental school, I was able to question my mother. I said, was I really allergic to penicillin? She says, no, your grandfather was allergic to penicillin. So I figured maybe you would be allergic to it. You know what, Iris, we'll be back in just a moment. We're going to take a break. It's Dr. Kenny Levine with Health Talk. We'll see you in a minute. Thank you.
When you're smiling,
First impressions are priceless.
I'm Dr. Kenny Levine. For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.